Hi, my name is Dr. Chris Gubbels, and I'm here at Square One Fort Collins Auto Injury Treatment Center. And today I just want to go over some basic injuries that we find are frequently missed from people that are in car crashes. One of the first things I want to let you know, if you were in a car crash and someone tells you have your whiplash, whiplash is not a diagnosis, it's a mechanism or a way that injuries that can happen, and a lot of times that will happen when someone is involved in a car crash. Now, we frequently get patients that come to our office after have gone to the emergency room or have been to other providers first, and we see that many times the most basic, simple tests that should be done with anyone in any kind of trauma, let alone a car crash, are not done. A lot of times patients will come in, they'll have an x-ray in a neutral position, but a lot of times you will miss many injuries if you're not looking for them when you take without taking the joint to full range of motion. What I mean by that is, you think about an athlete that tears the ACL or tears the ligament, when they're just sitting with their knee in a normal position, it may not hurt at all. You may not be able to see the injuries. But when you take those joints and you move them to the end range of motion, or you flex it or extend it, then you can now see those injuries. The same thing happens in the spine. So typically in a whiplash trauma, the injuries do not occur when someone's neck is like this. You will only see them when the neck is all the way flexed or all the way extended. And so you have to take x-rays with those joints at end range of motion to see certain injuries, specifically when you have ligaments that are damaged, when you have ligament laxicity or instabilities. And then not only do you have to take those x-rays into position, you have to have the proper software where you can objectively measure those. And I'm going to show you some of those x-rays. Okay, so like I mentioned, first thing is whiplash is not a diagnosis, it's how things get injured. And whenever someone has a whiplash injury, the number one thing that has to be determined is specifically where are the injuries. And we're going to talk about a few and how we evaluate those. First of all, the injuries we're going to talk about are ligament injuries, just so you know what those are. If you look at this simple picture and diagram, the part right here is bone. This would be the front of the spine. This would be the back. These are what's called the disc. You've probably heard of those. And these structures right here are ligaments, right here, here, and in here, same thing up here. And what ligaments do is they keep joints together, they connect bone to bone, and they keep joints from moving beyond normal motion, or they keep them from moving within a normal limit. And they protect you from injuries. This is what happens in a whiplash. This is what happens when someone's in a rear impact or a hit from behind. Over here on the left is a normal cervical spine. The first thing that happens is there's an S-shaped curve that happens, and then eventually the neck completely snaps back. During this, ligaments in different areas of the spine can be stretched and damaged, so we're going to have to take some specific x-rays or tests to check and see if those ligaments are damaged. Basically, there's different ways to measure instabilities. One could be if a joint flexes forward or backward beyond normal motion. The other one would be if it slides forward or translates forward, backward, and I'm going to show you a couple of those and how we check for those on an x-ray. And this is what I was talking about as far as the flexion extension x-ray. So over here on the left, this is the person that's their head's flexing down all the way. Over here on the right, the person's head's extending. These green lines are in the back of the vertebrae, and they're measuring how much the joint moves. So the ones that are green, the joint is actually moving with the normal range of motion. The ones that are red on here is a way that it indicates they're moving more than they're actually supposed to, and there's an instability. So an up-close view, if you look over here on the left, these ones that are red are actually instabilities. And so, for example, on the third and fourth vertebrae, this is very obvious. You can see this one slides back. These joints are moving much more than they're supposed to. And over here, where we're actually measuring the exact amount, I'm not going to get into that. This is a low back injury, and the ones that are in red are unstable. This one down here, it's the fifth lumbar. It's actually translating posterior, 5.9 millimeters, which is the major instability, and that's actually coming back into the opening where the nerve comes out. So if you look right here, that's the opening where the nerve comes out. You can't see that here because this vertebrae is actually translating posterior into that opening. That's a medical instability, and this is when someone was actually bending backwards. This is a different patient that was hit from behind, and they have this different instability. This is a great example of someone that had a head-on collision. Now, if you look over here on the left, this is how most x-rays are taken. The person is actually looking straight ahead. A person that's trained in biomechanics would know there's actually an injury right here, but we have to have the person flex forward to really see and measure that injury or instability. And that's what we are actually seeing over here. The person's flexing forward, and then you can actually see right here this fifth vertebrae. You can see it's really narrow in the front, it's really big in the back. The ligament back here is probably being damaged or pulled. There's actually some joints back a little further, right where the arrows are at, that are probably being damaged as well. I'm not going to get into that, but the main point is you would never be able to see this without doing a specific x-ray. So why does this matter? Well, this is from injury and repair of the musculoskeletal soft tissues. If you look at right here in the normal, this is what a normal, healthy ligament, a strong ligament looks like. Over here on the right, this is a ligament that actually has been damaged, and it's actually starting to build up scar tissue. That's what happens to the tissue when it's injured. And it's very obvious to anyone, this ligament is a lot stronger than this, and so we need to know if these are going on so we know the proper treatments to actually do those in. So if you were in a car crash and you think you've had some injuries, first of all, if you went to someone and they didn't do some of these basic tests where you're looking forward and backward and actually measure for instabilities, make sure you get to someone that can do that. Or if you know someone that's been in a car crash, make sure that these have actually been checked for, because if not and they're missed, and you get some of this stuff going on, these injuries aren't ever healed properly, you could have chronic pain. So if you live in Fort Collins and you were involved in a car crash or know someone that was, give our office a call, ask for a free consultation so we can determine what injuries you may have and what might be the best course of treatment for you.